Hi, it's Dr. Morris from Magnolia Medical here in Tennessee. Hope you're doing well today. Um, when you get to watch this, do me a favor, post where you're watching it from. Let me know how you're doing. We'd like to keep up with where we're contacting people from. Um, wanted to talk about this. I had a patient, had not, a patient, potential patient, somebody who wanted to come in and was talking about getting stem cell therapy and for their pain. And they came in, this was before Christmas sometime. They came in and they had a consultation, and it was great, good experience that they had at our office. And then they went back to their doctor, and their doctor told them that he now that the person's in so much pain, is looking for alternatives, wanting to get out of pain. The doctor said, well, I think that you should not do stem cell therapy, and we should do a spinal cord stimulator for you. So what do you guys think of that? Don't do stem cell therapy, do spinal cord stimulator. All right. Now, one of the requests of this patient was that they were able to come off their pain medication. So this is a noble quest for them to be better. And I would argue that if you had a competent doctor who could install the spinal cord stimulator and it reduce your pain, that is a better option than being addicted to medications and going along with all the side effects of that. However, there are side effects and risks with surgery. So as you know, if you've been watching me, you know my opinion is not to cover up problems. It is to fix problems. So the issue that I had isn't that the patient said, yeah, I want to go and try the spinal cord stimulator. Here's a patient who wants to be out of pain. It's her goal. She wants to live a better life, and she wants to be out of pain. So totally understood. Nobody wants to be in pain. She wants to live a better life. The problem that I have is that this doctor told her, let's do a spinal cord stimulator and don't do stem cell therapy. Now, why would that be? Why would a doctor say that? And the truth of the matter is, I don't get that at all. Deborah have spondylosis from cervical all the way down, 2 times a second, flexor brisk again, so might need another operation. Yeah. Stem cell therapy might be able to help you, Deborah. We've seen it. They're neurogenic in nature. They can help grow back nerves. That's what the science shows. So let me get back to this. The issue is that if somebody has a degenerative problem and their body's breaking down and it's causing them pain and causing degeneration and causing them to lose their ability to live their life, and they take a medication for that, or they try to do something for the pain. I'll ask you this. While they're taking the medication or doing something for the pain, are they continuing to degenerate, or are they continuing to degenerate? And the answer is, if all you're doing is cover up the pain, if you cover up the check engine light on your car with a piece of black electrical tape, the car's not going to get better on its own, right? And the engine problem's not going to get better. None of those things are going to get better. And factually, they're going to get worse. So the issue that I had is with this doctor saying, hey, we should try a spinal cord stimulator and try to handle pain rather than actually try to fix the problem by helping regenerate and heal tissue. Like, am I the only one that this doesn't make any sense to? Like, where are it doesn't matter to me whether that patient came here and got stem cell therapy. It's what matters is, are they going to get better? Are they going to improve their life long term? Or we're just going to put a Band-Aid on something and say, I actually met a patient last night. I was given a lecture on stem cell therapy, actually. And the patient was told by her doctor that she said, I really want to be proactive. She has a little bit of knee pain. I want to be proactive for my knees. And she goes, almost from the standpoint of maintenance, because the knee pain's not that bad. So the doctor took an x-ray and he said, yeah, you got a little bit of degeneration there, but nothing that bad, nothing we're gonna address right now. Let me know when it gets bad, and then we'll do something about it. Now, to me, that is asinine. All right, that's asinine, right? You're gonna wait until it gets bad? Like, that's saying, let's wait until the engine falls out of your car before we change the oil. Like, am I the only one who thinks that's ridiculous? So this patient goes to a doctor and said, hey, we should get a spinal cord stimulator. I think that there are cases where that works. I've had patients where they said it's worked well for dealing with their pain. The only problem is while they have relief of their pain, they're continuing to degenerate. And what's their life going to be like as that problem gets worse? So versus they're doing something to actually work at correcting the problem, which science shows is a valid way of handling it. There's no guarantees in healthcare, so it doesn't mean if we did stem cell therapy, she would get her results. We have very good results, a little better than 90% actually right now. But the issue that I have is not trying to fix the problem. And I think that's the problem with most of modern Western medicine, is that we're trying to cover up symptoms too much instead of trying to fix the problem. So I see some people posting they might need other surgeries. Hi from the UK, Paula, Deborah, Dina. Glad to see you all posting. I know a lot of, I actually get to lecture around the country. I lecture about 12 times a year to doctors and nurses around the country, medical doctors, chiropractors, nurse practitioners, physical therapists, osteopaths, physician's assistants. And I feel blessed to be able to do that, and that they actually have respect for my knowledge. And I lecture on things regarding how to heal people without drugs and surgery, And the interesting thing is I also lecture to probably north of 5,000 people a year, not healthcare providers, in and around our community on the subject of health and wellness. And when I ask people, and I've asked a lot of people, do you want more drugs and do you want more surgery? Do you know, every single one of them says no. They'll say, no, I don't want to do that. They don't want more medication. They don't want more drugs. So when I see comments and they say, I'm having another surgery, most of you don't want to have another surgery. So you got to spend time looking for other options. I see, somebody posted, I wish maybe, I'm not sure what that means. I wish, is stem cell therapy not available where you are? Is it a cost thing? Like, what are the issues with you being able to try something that's an alternative? I don't know. I'd really like to know. I'm asking. So those are issues, right? You've heard me talk before, my disdain for the insurance industry. The insurance industry and the pharmaceutical industries are bedfellows. They love each other, man. They're right in time with each other. So anyway, I just wanted your opinion. What do you think? Stem cell, a spinal cord stimulator versus stem cell. What do you think? The point being is, what do you think? Fix a problem, have a chance at fixing a problem, regenerating the person's body, versus covering up the symptoms. What would you choose, and why? Like, what are your reasons? Why would that be? So tonight, it is looks like it's about 3:45 my time. That's Central Standard Time in the U.S. Tonight in probably about 6:30, maybe 7 o'clock my time. For those of you who are not in this country, it's Chicago time. Well, I'm in Nashville, but it's, Central Time is like Chicago time. So if you need to look that up, I'm going to come on tonight, I hope, barring any messes up with the schedule. And I'm going to talk about the vaccine controversy. I want to know what you guys think about that. So, a lot of people are saying, no, don't vaccinate. Some people are saying, oh, do vaccinate. I'm going to give you my opinion on it. I'm going to give you some science behind the good and the bad regarding this. And I would love to get some interaction tonight. We're going to do that about 6:30 or 7 o'clock my time. But do me a favor, give me some likes if this subject is important to you, not just the vaccine controversy and stuff, but the subject of stem cell therapy, spinal cord stimulator, covering up symptoms versus fixing a problem. Give me some likes if this subject is interesting and helpful to you, so I can help give you information that's valuable to your life that you can use to change your life for the better. The other things, if you could share this with people, if you know somebody's had a spinal cord stimulator or is considering stem cell therapy, if you could share this on your page or other people's pages so that they know that there's alternatives, and also kind of get an idea what I need an idea what people think about these ideas that we're talking about, so that we can move healthcare forward. I think it's hard to say that the healthcare is living in the past, meaning like this old ideas, because there's been so many great advances in healthcare, or at least in diagnosis. The MRI is a phenomenal advancement, X-ray, there's all kinds of great advancements in diagnosing, but at least in the United States, we're really, really, really behind in how much it costs to try to get somebody well. And we're still really, really, really stuck in the disease management model rather than a fix-it healthcare model. We have, and I know some of you from other countries here, but I'll tell you statistically, the United States has the best acute care in the world. So if you were shot, if you were had a life-threatening infection, if you had a stroke or heart attack, statistically speaking, there's no better place in the world to be able to save your life than right here in the clinics and hospitals in the United States. However, when it comes to chronic health problems, we have the most expensive, least effective sick care system on the planet by far. If you go to a website called the Virtual Capitalist, I don't know why it's called that, but it's a bunch of graphs about things, and there's a graph on there that shows dollars spent per year versus life expectancy, and they rank like the top 40 countries in the world. And the United States is by far the most expensive, and we have the least life expectancy, and it's not even close. Everybody else is like this, and we're like this on the graph. Like we spend so much more for so much less. And I'm sick of that, right? I'm sick and tired of our system not working. And as some of you in other countries have had people from South Africa and even in places like Indonesia and New Zealand and Australia comment, and I find that we run into the same problem in other countries. But from a cost perspective, you can't beat the United States. You just can't beat us. We are so ineffective with our healthcare dollars. It's not even funny. So anyway, if we can help you out in any way, if there's information you want or a subject you want us to talk about, again, I'll solicit what you want to hear about. Again, tonight I'm going to talk about some vaccine issues, some things that have come up recently in talking with my wife and some patients and whatnot, and some things that I've known about for quite some time that are worth discussing. I saw an article today from that Eli Lilly, one of the largest pharmaceutical companies in the world, is buying up another company for either some biologics company or it might be a cancer drug company. And Eli Lilly's done some pretty shady things over the years, and I always look at that and I go, man, there's all these mergers on these pharmaceutical companies. What are they going to do with these drugs? What are they going to do? Are they going to mix things together? Anyway, so that's the conspiracy theorist in me, if you will, regarding the fact that we're just trying to make money at the expense in an unethical way. Okay, I mean, I don't have any problem if you found a way to really help somebody. I have no problem with you getting reimbursed and remunerated for your help and assisting someone else if it's real help. If it's real help, but too much of it is fake help. Too much of it is, hey, we're going to help you. Or we're going to do our best to help you, and all the research and all the information they feed you is a bunch of bunk, and it's not true at all. So anyway, tonight about 7 o'clock, I'm going to come back on. Appreciate you watching. Hit that share button for me. Love you guys. This is Dr. Morris from Magnolia Medical, signing off for now. Take care.